Hello friends, in this video I'm going to talk to you about breast lift. These are patients whose breasts are really saggy. Maybe you have done a breast implant and after a breast implant the breasts have come down and you're not happy with the shape of your breast because you did a breast implant in the hope that the implant will make the breast go up. That is what your doctor told you. But after the implant the breast has become even more low. Or they did a breast lift surgery with implant but somehow it didn't work so well and the implant pulled the breast down. So I'm going to explain how we tackle that particular concern at Divine. So if we see here, this is probably the shape of the breast that you have. The breast is all down. Instead of being like this, the breast has come down. Now of course you want the breast to look like this, a happy breast. So on the side your breasts are actually like this, just hanging, whereas they should have been looking in front like this. So how do we tackle this? I am going to show pictographically on the board how we tackle it in a way that you will understand. Now let me take you to the anatomy. This red or brown layer that I have, these lines that I have drawn, this is the muscle. The muscle is like this. The pectoralis muscle, so which is like this. So this is the muscle. What we do is we make the incision, we make the cut, remove the implant. We've kept the implant here. In this muscle, we make a split like this. So the muscle is divided in the middle and this part of the muscle is opened like this. So the muscle which was like this is split in the middle and it is opened like this. The implant is taken and kept here. So this is the muscle, the implant is kept like this. Previously the implant had fallen down till here. Now I made the muscle like this, kept the implant like this and like this, and the implant is sitting on the muscle. And this muscle I stitch to the tissues here, and therefore the implant cannot move down. It is not possible so downward movement is not possible because the implant is now held by the muscle. So this acts as a chair, and then we tighten the skin, we remove extra skin, and the breast from looking like this now starts to look like this. So this is how we do. This is called as the true dual plane approach, and this is something which we've been doing for patients who have done breast implants previously. They've got a lot of sagging and they're not happy with their shape. After the surgery there's about 2 weeks of pain, so it's a little bit of a recovery process. Of course 3 days later you hardly feel it, but when you do upper body movements, tight movements, you will definitely feel a little bit of pain. And that usually settles by about 2 weeks. You will need to wear a sports bra for 3 weeks, and after that you can start off with your exertional activities as well. So if you have been suffering from post breast implant sagging, please contact us because this is an amazing solution which we are doing. This is a Brazilian technique mastered by a surgeon called Dr. Milton Daniel. I have observed him in Brazil, I worked with him in Brazil, and this is the technique that I have been doing in order to achieve very good success in patients like this. Once again, my name is Dr. Amit. I'm a plastic surgeon. I'm founder director of Divine Cosmetic Surgery. Please connect with my team on the numbers given below to contact us.